Welcome everyone to today's webinar. My name is Angela Knox and I will be presenting today along with Deb Harris. We are going to go ahead and get started with the webinar. We're going to first look at today's agenda. All right, so Deb is going to be presenting on the MIPS overview. She'll continue with review quality scoring, and then what to consider when selecting measures, and then collecting data with AdvancedMD. I will be introducing a new module, AdvancedCQM, and we'll be showing some screens on that. So Deb, if you want to go ahead and take it from here.
Great, thanks Angela. And for everybody if you have questions during the presentation, please send them via the chat window, and if time permits, we will address the questions after the presentation. Most of us, are familiar with MIPS, but let's do a quick overview. And we'll first start with ACI, the Advancing Care Information. The ACI score evaluates eligible clinicians on the use of the certified EHR technologies. So eligible clinicians must use either 2014 or 2015 certified EHR. The category is comprised of two scores. You have the base score and the performance score. And the base score requires either a yes or no, or at least one for numerator and denominator for all base measures. And then the performance score is based on the performance rates for selected measures. And for ACI, it is a 90 consecutive days for reporting. Then we have the improvement activities. This category rewards clinicians for participating in and completing patient-centered activities that have a proven association with improved health outcomes. CMS has finalized over 100 activities that designated as either high or medium weight, and clinicians must attest to completing a combination of these activities. Participation in certain patient-centered medical homes will receive full credit for this category, and APM or alternative payment model participants will receive at least 50% credit. Then we have the cost category. CMS calculates costs based on submitted Medicare Part A and Part B claims data, and there is no additional reporting requirements for clinicians under this performance category. The assessment is based on total per capita costs and or the MSPB, which is your Medicare spending per beneficiary. The total per capita, patients are attributed to the provider with the plurality of primary care services provided. And for the MSPB, a hospitalization episode will be attributed to the provider with a plurality of services provided during the episode. For our webinar today, the focus is the quality category. This category evaluates providers on self-reported quality of care provided. The quality is 50%, counting for half of the total MIPS performance score. So there's a lot of emphasis on our quality and the quality measures. Eligible clinicians must report 6 measures for full credit in this category, including one outcome measure or an additional high priority measure. Clinicians reporting fewer measures will be scored on the measures they submit. Performance is evaluated based on the full calendar year, so January 1st through December 31st. There is no 90-day reporting option in 2018. And the numerator data reported via registry or EHR Direct must include at least 60% of the measure's entire patient population across all payers, and a minimum case volume of 20 is required for each measure for full credit. So let's move on to the quality scoring. Essentially, as most of you know, the quality category structure is you select your measures, and each of the measures are rated on a decile-based benchmark ladder. You earn up to 10 points based on achievements in comparison to your peers. Quality measures that can be scored against a benchmark will receive between 3 and 10 points. For quality measures that don't have a benchmark or do not meet case minimum, most measures look for a 20 case minimum or a denominator of 20. So any of these measures, they will receive 3 points. And for 2018 quality reporting, measures not meeting data completeness requirements will receive 1 point instead of 3 points allowed in 2017. Now, the one exception is small practices. consisting of 15 or fewer eligible clinicians, they will receive 3 points. Data completeness requirement for 2018 is at least 60% of all payer patients or qualifying visits for the denominator of each measure reported. So if you choose to meet the quality category via claims reporting, then the data completeness is at least 60% of Medicare patients or visits for the denominator. Moving on to benchmarks. So the benchmarks are calculated based on historical submissions to CMS. For example, the 2017 reporting benchmarks were based on 2015 PQRS and CAPS, and 2018 is based on 2016 PQRS. I mentioned in the previous slide with the quality scoring that for benchmarks that for quality measures that don't have benchmarks, there are quality measures that we don't have that history from previous years. So those benchmarks that we have may be adjusted, but also new benchmarks will be added throughout the year based on those quality measures that didn't previously have a benchmark from previous reporting years. And then we have measure benchmarks that vary based on the submission method. And what I did here is I pulled a screenshot from the CMS Quality Benchmark resource site to show you that here with this example for the preventive care and screening for the body's mass index, that based on how you submit your measure determines the points that you would get for that measure. So here we have the same measure, and you can see the performance rates and the different points based on the submission method. For claims, if I'm submitting via claims method, and I have about an 83 or 84%, I'll get 6 points for this measure. But by reporting with the EHR Direct, you'll notice that I would have 10 points for the measure. So you get more. For many of the measures, you get a higher decile point if you report using EHR. Now, there are more than 270 measures for the 2018 performance period. The submission method is top on our list because there are different measures across the submission methods. And for the same measure, your points fluctuate based on the submission method as we reviewed on the previous slide. Also know that measures have benchmarks. You can refer to the CMS MIPS Quality Resource Library to retrieve a spreadsheet containing all the measures for 2018 reporting. And remember, you cannot earn 10 points for measures without benchmarks. The highest potential earning is 3 points. So when you're selecting your measures, look for those that have the benchmarks so that you can gain the higher number of points. And if you are reporting via EHR, there are 54 measures to choose from. The advantages of EHR Direct, also known as eCQM or Electronic Clinical Quality Measures, are the higher points that you'll gain from those. And there are only 8 measures under the EHR that require 100% to earn 10 points. So in that previous slide, when we were talking to the BMI measure, at just over 80%, you get the decile point of 10 for that measure. So you don't have to always have 100% for a measure to get the 10 points for that measure. And in comparison to claims reporting, for that same measure, you may only get the 6 points. And what we do like to suggest is that if you're doing claim submission today, that you also do the EHR submission so that you have both options when you're submitting to CMS. And also remember that the data completeness for 2018 is 60% of qualifying patients or visits. So you must meet data completeness to earn more than 3 points for each measure. And this is important because it's not to be confused with the 50% scoring for the MIPS performance category. This is 60% of your patients or visits to ensure that you're qualifying for that measure. And finally, choose more than 6 measures. You are not penalized for reporting more than 6 measures. Of course, the 6 measures must be in the same submission method. And if you decide to submit via 2 different methods, You will need 6 measures for each submission method. However, the measures can overlap, so you can keep that in mind. And CMS will then choose the method that provides you with the highest score. So next is collecting the data. After we've selected the measures, the next step is collecting the data. Using AdvancedMD data collection is in the workflow. The data is automatically collected as you record the patient visit, documenting medications, recording problems and conditions, adding immunizations, placing orders, and receiving results. And also documenting your vitals, your assessments, and much more in the patient note. The AdvancedMD Content Library offers over 60 templates you can add to your existing visit notes to assist in documenting data needed for your quality measures. And we have included additional guidance in each quality note to help you better understand the requirements of the measure and what data needs to be collected. And with AdvancedCQM, as data is collected, you can see how the clinical data translates to the measures that you selected. So now let's review the AdvancedCQM module, and I will pass the baton to Angela, and she will explain how AdvancedCQM works.
Great. Thank you, Deb. All right, as Deb mentioned, we're going to take a look at the AdvancedCQM module. To get started, I want to mention that one benefit of AdvancedCQM is the ease of access. To open the module, all that I have to do is select from a drop-down menu within AdvancedMD. So there's no need to log into another program where you would need a new login name or password. Users logged into AdvancedMD will have direct access as long as the privilege is assigned. So in regards to privileges, there are 2 different ways to view the reports. There's a setting for users that need to create and manage multiple provider reports for, so for example, maybe an office manager. Or there's a setting for the provider who may only want to view his or her data. So it's very easy to access. There's different ways to view the reports. As mentioned, a single view, a multiple provider view, and both of those are easily managed in the user role setup. So once you open AdvancedCQM, before you can run and view a report, you will need to select the quality measures. Within the program, you have the option to pre-select the measures or just add the measures when you create a report. As Deb mentioned earlier, there are 54 EHR measures to select from. Once patient data is captured in the system, AdvancedCQM pulls the data to calculate the performance rates. So if we look at the current screen, you can see how easy it is to create a report. You simply fill out the fields on the left, the description, the dates, you select your measures, and then you queue the report. So go ahead and we'll look at the next screen. Okay, so this screen shows the home page and has 3 different reports created for 3 different providers. So this is an example of the multiple provider view. When we talk about ease of use, another benefit is that users will not need to recreate a report every time they access the module. The only time a report may need to be recreated is when you want to add a new measure, maybe remove a measure. But once it's created here on the home page, all I have to do is hit the rerun icon. And I think Deb is going to point to that little rerun icon. And it's going to update the report right here on the home page. So it's super easy to get your data back in. So to open the report and to view the performance rates, we just select the view reports or view results. Okay, so this screen shows the report dashboard. On this screen, I see the list of selected measures and the corresponding performance rates. In addition, I see the number of patients that have met the initial patient population, or IPP, the denominator, exclusions, numerator, and exceptions, if there is an exception to that particular measure. So this dashboard shows the performance rates at a high level. However, AdvancedCQM doesn't stop there and provides much more details. By selecting View Details for each measure, I can really start to look at the specifics that make up the patient visit. All right, so let's look at the patient list. Okay, so I've hit View Details, and now I'm looking at the patient list, which displays, patient by patient, who is and who is not included in the measure. The green check marks tell us that the patient has met the requirement for that given category. So for example, on this screen, the first 3 patients are included in the IPP, the denominator, and the numerator, whereas the remaining patients are included in the IPP, but for one reason or another, the patients are not included in the other categories. A lot of patients will fall in the IPP category. However, patients will not be included in the other categories unless they have met the requirements. A missing or unsigned charge slip is a good example of why a patient may not be meeting a certain measure. So this is the patient list. Once you select the green check mark, or you can even select one of the empty boxes, it's going to take you to the drill down screen. Okay? So the drill down screen is the nitty-gritty details of that patient encounter. A blue check mark indicates the patient has met that requirement. A red X indicates the patient has not met the requirements. So with the patient list and the drill down screen, I can research and determine why certain patients are not meeting the measure. So this is very helpful when it comes to improving low performance rates. I can review CMS's measure requirements and compare it to what's on this drill down screen to see, what's the discrepancy, what are the details, what's missing or perhaps incorrectly documented. So that is one of the great things about AdvancedCQM is you can really drill down and get to the encounter level. Okay, so the last slide we're going to look at is going to show you the QRDA reports. So this is on the details screen within AdvancedCQM. This is where users can download their QRDA reports. Once you have all your measures and metrics in order, and when you're ready to report your measures for CMS, you are able to run your QRDA reports from AdvancedCQM. So this is the initial look of the new quality measure reporting module within AdvancedMD. So Deb, I'll let you take it from here.
Great, thanks Angela. So just as a recap from this webinar is, what are the benefits of AdvancedCQM? And from what we've learned today about the quality category scoring and benchmarks, AdvancedCQM provides many benefits. It simplifies the collection, monitoring, and reporting using an EHR. And using an EHR to report quality measures equals a higher MIPS quality score. So you get higher benchmark points and bonus points. Also, it's easy to monitor your quality category health and achieve appropriate percentages and meeting case number requirements because you'll have this information at your fingertips. And then two, with using AdvancedCQM, you are able to create the QRDA files for submission to CMS. Okay, so this concludes our presentation, and I think we probably have some time for questions. Angela, do we have any questions on the call?
We do. Let me pull one up here real quick. All right, here's the first question. How can we make our existing patient notes compatible with the 2018 quality measures?
Okay, so if you're an AdvancedMD user, you can contact AdvancedMD support, or you can work with our professional services team who specialize in all things MIPS.
Okay, here, I have another question here. If our office is submitting claims today, do we have to report from the EHR as well?
So let me...
Do you want me to repeat that?
I'm just trying to think. Okay, so if you are submitting claims for the set measures that you plan to report for the 2018 quality performance category, then you do not have to report measures via EHR registry. However, if you plan to transition over to EHR reporting for your future years, this year would be a great opportunity to do both your claims reporting and EHR. Because remember that as we had discussed earlier in the webinar, you are able to submit multiple methods to CMS. You do want to make sure that each method that you submit, that you have at a minimum, chosen 6 measures or measure set. And then CMS, when they receive these submissions, they will take the higher of the submission scores. So you can continue just to submit claims, but if you want to take it one step further in preparation for future years, using both the EHR or a registry and the claim submission.
All right, I have a next question. What if a quality measure does not have a historical benchmark?
Yeah, so for measures without historical benchmarks, most of those measures are the new measures that different organizations have submitted to CMS to be used for 2018. And the CMS and the organization that has submitted the measure, they will attempt to have a calculation for the 2018 performance scoring. But if there's not any historical data that exists, then the measure, like for this year, if we have a new measure, it will receive only 3 points. And that is as long as your data completeness is met. So there's two pieces, right? So if you don't have a benchmark for a measure, you will not get more than 3 points or earn more than 3 points for that. But you also have to make sure that you still have that data completeness, which is the 60% of your patient visits for that reporting period for that year.
I think this is a common question I see from time to time. What is data completeness?
And it kind of ties into what I just talked about. Mm-hmm. Let me try to articulate this a little bit better. So for 2018, because each year this will change, we know that. For 2018, data completeness is at least 60% of all payer patients or visits qualifying for the denominator of each measure to be reported. So it's each measure, not across all 6 measures. And, for EHR direct and registries, it's across all payers. And if you're doing claims reporting for your measures, it is 60% of the patients or visits under Medicare for your Medicare only. So that's the one difference between claim submission and the EHR and the registries.
Okay. Let's see here. Our office are AdvancedMD clients. How can we get AdvancedCQM?
So what I would ask is that you contact our AdvancedMD sales team, and they can provide you the details so that you can get started with AdvancedCQM.
Okay. Well, I think that is all the time we have for today for questions. Do you have anything else are we good or?
I think so.
Wonderful. Well, thank you everybody for joining today's webinar. This will be recorded and provided in Nest within AdvancedMD. Have a great day.